Do you have PCOS and want to learn what that means to your body and how to manage that naturally or even completely reverse the symptoms of your PCOS? Then you're in the right place, because this group, we are dedicated to supporting each other and helping you learn what it means to have PCOS, how that affects your body, and most importantly, what natural measures you can take to minimize or completely reverse your symptoms altogether. Hi, I'm Ashleen. I'm the founder of Nourish to Healthy, and I want to welcome you to this group. Just so that you know the information that I share in this group is credible, I want to let you know I'm a physician assistant. I have my master's in physician assistant sciences, which mirrors the second and third years of medical school. I have over 6 years of experience treating and diagnosing patients in medical conditions. But besides understanding the science of PCOS, I personally have PCOS. About 5 years ago, after battling infertility for over a year, I was diagnosed with PCOS. And the protocols and methods that I teach here in this group are the exact ones that led to me finally getting pregnant, naturally, without any medical intervention. Since that first pregnancy of our oldest daughter, who's now just turned 4, we've had a second daughter who just turned 2, so 21 months after our first, we had a second daughter. And I'm now 27 weeks pregnant with our third child, who will be due early in September. So all again without medical intervention. So the point here is that these methods work. Whether or not you are trying to get pregnant or not, our fertility is a direct correlation to how well managed our PCOS is. As we manage our PCOS better, all of the symptoms disappear. The struggle with weight, the struggle with acne, whatever it is that brought you to want to learn more about your PCOS, our fertility is a very good indicator of how well our management is working. Sadly, the more women I talk to and the more women that I work with, including myself, I hear over and over and over that they were very disappointed in what their physician had to offer. There just isn't a lot in the ways of treating PCOS. We're going to get into that a little bit more later in this video. But what we all want, and what leaves us feeling frustrated, hopeless, and more discouraged than when we went to our appointment, is we want to know, what is the cure? What can I do to relieve these symptoms once and for all? Unfortunately, PCOS does not have a cure. You will always have PCOS, but you can completely reverse the symptoms, and that's the amazing news. Your lifestyle and the choices of what you eat and how you live can have an enormous impact on how your symptoms show up and how severe they are, or if they go away altogether. So first and foremost, what is PCOS? It is a hormone disorder where you have unbalanced hormones and you have a metabolic component to it. A metabolic component simply means that you have risks of diabetes, you have risk of heart disease, you have risk of hypertension or high cholesterol, or perhaps you have already developed these. That's the metabolic component. So between the hormones and the metabolic component, this disorder spans many areas of your life. Symptoms include everything from irregular menstrual cycles to infertility problems to increased risks of miscarriage if you do get pregnant. Besides the reproductive system, it can decrease hair growth to the head while increasing hair growth to other areas such as the face, fingers and toes, chest, abdomen, you name it. If a man grows hair there, you will be more prone to growing hair there. It's a disorder called hirsutism. It can cause sleep problems, energy problems, headache problems. It can lead to mood changes, and this is something that we often don't correlate with PCOS, but it can increase your risk of anxiety and depression. These are no joke, and the medications that they put you on for these can increase your other symptoms. So learning to manage everything naturally the best we can, even if we go on other medications, is still extremely important. Once diagnosed with PCOS, your healthcare provider has very limited options of what medications they can offer. We're going to go over a few of those just so that you understand what they do and do not offer your PCOS journey. One of the first options that most physicians go to is birth control. What does birth control do? Well, from the standpoint of healing or curing PCOS, absolutely nothing. What it can do is it can help to regulate your cycle, okay? That's not going to help you get pregnant because you're on birth control. It's not regulating your hormones. It's simply forcing your body to follow a regular pattern or doing away with your cycle altogether. Which can be helpful for women who have very painful and awful periods. But keep in mind, it's not treating any underlying issues. And so oftentimes when we go off birth control, we rebound with our PCOS quite significantly. And birth control has some serious side effects that we don't want to overlook. It can increase your risk of diabetes. It can increase your risk of blood clots. It can increase your risk of heart disease, all of which you are already at more risk when you have PCOS. So unless you need the birth control for a specific symptom that it is helping with, it may not be the best choice. However, even if you do choose to go on birth control because you, one, don't want to get pregnant, and that's a reasonable reason to go on it, keep in mind that the lifestyle factors are still very important so that you are actually treating the underlying problems of your PCOS and not just covering them up with a mask of the birth control pill. The next medication that your physician may offer you is something called Metformin. Now, I think Metformin is a very good option for women that have PCOS. However, there's a lot of side effects that make it something that a lot of women can't tolerate. And at the end of the day, you still cannot out prescription or out medication a poor choice of diet. So lifestyle choices are still beneficial, but Metformin can, if tolerated, really assist you in reducing your insulin resistance. Now, insulin resistance is a big component of PCOS. Having high levels of insulin, because you're insulin resistant, increases your testosterone, which plays into your symptoms, and it creates a cascade of problems. So PCOS, in a sense, is something where the worse it gets, because it feeds off of each other. And then also, as you start to improve your lifestyle, it goes the other way. And so you can make some momentum the other way, and that's why you can actually completely reverse your symptoms in most cases. So Metformin, it's up to you. If your physician's willing to prescribe it, try it. It can help to really reduce your insulin resistance. We see some great results with that. However, it is not well tolerated. And the whole point of this group is to help you feel better in your body, not worse by taking a medication that makes you feel like crap. But as with all medications, you want to talk to your doctor before starting them or stopping them. And this video is purely just to help you understand what they do or do not do based on the research, but not necessarily if you should or shouldn't take them for your specific situation. That's between you and your health practitioner. The next medication that you may be offered, especially if you're dealing with something like acne or hair issues, is something called spironolactone or aldactone. It's actually a medication that was put on the market to help high blood pressure and heart disease, and specifically for heart failure. But we found that it actually blocks some of the hormone receptors, and so we see improvement in symptoms of PCOS for patients taking a slightly lower dose of spironolactone than you would for your heart disease. Most patients tolerate it very well. There's very few side effects. I do want to point out that if you go this route, it is not safe to take while pregnant. So you should be using some form of birth control or protection method so that you don't get pregnant while on spironolactone. So that brings us to the end of what your physician can really offer you, other than sending you on maybe to a referral of a specialist, such as an infertility specialist, who may go down a long road of Clomid, letrozole, IUI, IVF, and so forth if pregnancy is your goal. Now, in all fairness, your practitioner is limited with the resources that science has provided them, and they're not there to help counsel you on your lifestyle changes. That's why I started this group, and that's why I left a practice of over 6 years, because I felt limited in my ability to impact my patient's lifestyle. I wanted to be able to share with them all of the benefits of lifestyle, but it takes a lot longer than the time that we have in a physician's office. The system is simply not set up that way. Let's talk a little bit now about how PCOS works in your body, how it is diagnosed, and so that way in this group you have a little bit of a base of knowledge to understand the other videos that we will have coming. So there's a long list of hormones that we look at when we're considering the diagnosis of PCOS, and then how we are going to go about treating and managing the PCOS. We look at the luteinizing hormone, which is LH. We look at the follicular stimulating hormone, FSH. We look at testosterone, both free and total testosterone levels. We look at DHEAS, which is actually a hormone that helps to regulate and uptake and kind of recycle some of the other hormones. We look at prolactin levels. We look at progesterone, estrogen, and of course we're going to always evaluate your thyroid with your TSH. Just to rule out that there's not another issue going on that's causing the other hormones to be out of balance. So, how do these work in your body? So the typical ones that we really want to look at are testosterone and LH. So here's kind of what happens. So we have testosterone, which is increased. We have an increase in testosterone. Then we have an increased ratio. A normal ratio is LH to FSH. Then we have a ratio of LH to FSH. A normal ratio is 1 to 1, which would look like this. LH to FSH. However, in PCOS, we have usually 3 times the LH to FSH ratio. So our ratio becomes more like this. Okay? So what we're looking at here is this hormone and this hormone. And how can we lower those naturally? So now, step over here. We're going to look at something called insulin resistance. Now, insulin, regardless of insulin resistance, is something that we all have as part of our digestive system. We eat something and we release insulin. Our body allows what we ate to go into our blood cells, or not into our body's cells and feed them. If we're insulin resistant, what happens is that we have to release more insulin in order to get the food we just ate into our body cells to give them the energy that they need. So regardless of whether or not we are insulin resistant or not, the foods that we eat are going to dictate how much insulin we need. If we are insulin resistant, we are going to need more to get that insulin to do its job and get that food into our body's cells. The measure or the magnitude of how much insulin that we need for whatever food we just ate can be surmised through the glycemic index of the food we just ate. Basically, the glycemic index is a measure of how much blood sugar that food is going to produce, and that means how much insulin that food is going to require to get it into our system and out of our blood. So you can think of it this way. Let me turn this. You can think of it this way. Glycemic index goes to amount of insulin. Insulin resistance, we'll say IR, insulin resistance, increases the amount of insulin, okay? The amount of insulin that we have circulating our body directly is going to affect how much testosterone our ovaries are producing. So the insulin is going to come down here to our ovary and tell it to make more testosterone and probably more estrogen as well, which is why we often see estrogen dominance. However, we don't worry about that one because it will fall into place as we treat everything else. As testosterone goes up, testosterone affects LH, increasing LH. So we end up with an increased level of LH, and FSH is sitting there doing its own thing, and our ratio is thrown off. When this ratio is thrown off, our cycle is thrown off, and we don't ovulate. Now, yes, that is a very simplified version of what's going on in our body, but I hope that helps you understand how all these things are linked so that when we talk about them further and how our diet and exercise and lifestyle choices and how we care for and nourish our bodies has an enormous impact. We can have an enormous impact right here. And that will cascade all the way down to the impact further down the line. As we correct this cascade, your periods will become more regular. And even if fertility is not your primary concern at the moment, it is a very good indicator of how well we are managing your PCOS. Now, insulin resistance is a big one. Another big factor that we look at in our lifestyle is inflammation. We know that PCOS is a chronic state of low-grade inflammation, and we'll also be talking about what lifestyle choices and changes can reduce our inflammation level. If you find this information helpful or other information in this group to be of assistance, I hope you share this group with other women who may be struggling with PCOS. It is not a fun disorder, especially if you're struggling on your own, and the support of a group is so important, especially ones that can send you in the right direction with science-backed information that actually works. So please share this group if you have anyone that you know that may benefit from this information. I am here in this group as much as I possibly can to help you understand your PCOS and get your PCOS questions answered. Please comment below the videos, comment in the group, post a question. I'm here and I will do my best to answer all of your questions or send you resources that will help to answer them for you. This is your group, so I hope you enjoy it and use it to support you along your journey of PCOS.